Hello there, welcome to Sòrò, Sókè Physiotherapy. My name is Toyin Odutola, also known as Ms. Bash, and here with me is Ife actually managed this lady, and he would like to talk about what really happened at that time.
The lady works in a business firm, and for people like that, their appearance has a lot to do with the profession.
Absolutely.
So she was going about her normal activities every day, and then suddenly she started to experience some pain in her ear. So she went to the hospital, and she was given some medication to handle that, and she got some relief. But suddenly, a few days later, she suddenly woke up one morning and saw that one side of her face had shifted. So it was of great concern to her, a young lady in her prime, so she was really, really bothered about it. So she rushed back to the hospital to try to find out what was going on. And that was where she was told to go for physiotherapy.
Good morning, everyone.
BC, you are looking radiant as always.
Thank you. You know I can't carry last.
That's why the whole office lights up when you arrive.
Please, let me settle down before you people make my head swell. You guys should let us get to work.
All right, our boss.
You are not serious. Leave me, Jure.
Well, my breakfast is on you.
We'll see about that.
BC, you always know how to make everybody laugh.
Life is too short to be serious all the time.
That's why we love hanging out with you.
So I was thinking if we could throw a dinner party after the financial year, or what do you guys think?
You are actually thoughtful. Because work without a little party is not cool at all. I'm fully involved, though.
Why is my ear hurting like this? Maybe it's just stress. Let me not assume.
Well, thank God I'm going to the hospital tomorrow, so I would just inform the doctor about this situation. I just hope it's nothing serious.
Good morning. What seems to be the problem?
Good morning, doctor. I've been having pain in my ear for a few days now. It feels uncomfortable, and sometimes I can't hear clearly.
I see. Have you noticed any discharge or ringing in the ear?
Yes, there's been a little discharge, and sometimes it feels blocked.
I see. I'll need you to do an ear test so we can be sure of what's going on.
Okay, doctor.
I've sent an email for your test. Please go to the audiologist. She will carry out the test.
I'm going to examine your ear now. It won't hurt.
All right.
Please stay still. Good. Okay, we're done. I will send the result to the doctor once ready. Thank you very much.
BC, from the test results, you have an ear infection.
Ear infection? Is it serious, doctor?
Not to worry. It's not serious, but it needs proper treatment.
I'll prescribe some medications. Make sure you use them exactly as instructed.
All right, doctor. Thank you.
Let me make sure I use these drugs properly.
I already feel better.
What's happening to my face? This can't be real.
Please, I just woke up and one side of my face looks different.
Calm down, BC. Go back to the hospital immediately.
I'm leaving right now.
BC, I'd like you to see a physiotherapist.
A physiotherapist?
Yes, they will help manage your condition effectively.
Okay, doctor, I'll do that.
Hello, BC. Welcome. We are ready to assist you.
Thank you, sir.
I've reviewed your case, and you're in the right place. The name of your condition is Bell's palsy.
Bell's palsy?
Yes, it affects the muscles on one side of the face, but the good news is that you will get better.
That is such a relief to hear.
Raise your eyebrows gently.
Like this?
Perfect. Now try to smile evenly.
It's difficult, but I'm trying.
That's exactly how progress starts. You continue these exercises at home.
How often should I do them?
Consistently, exactly as instructed. That consistency is very important.
I understand. I'll stay committed.
And make sure you call me anytime you need an assistance.
Yes, I will.
We would be expecting you next week for your physiotherapy continuation here.
Thank you.
BC, this is temporary. It's affecting my confidence and even my work. Then focus on your recovery. Follow PT Kunle's advice. I will. I really want my life back. I understand, and I am with you. You are more than a friend to me, but a sister. Thank you, my love.
Excellent progress, BC. Keep going.
I'm not giving up.
That's the spirit.
Thank you.
Wow, my face is coming back to normal. I'm so happy. Now I can resume to the office. I've really missed my job. Thanks to my physiotherapist, PT Kunle was so helpful.
Welcome back, BC.
Great to have you back.
Honestly, I'm so grateful for my physiotherapist. When I started, I was really worried about my face. It didn't feel like me.
But you look great now. I can't even tell there was an issue.
That's all thanks to the therapy. The exercises, the encouragement, everything made a huge difference.
That's amazing.
It really is. I've regained my confidence and I feel like myself again. I'm just thankful I got the right help from the physiotherapist.
BC, we need to celebrate your resumption tonight and all bills on me.
All right, oh, my boss with the money.
You deserve it, BC, our star girl.
So you just watched a medical drama series on Bell's palsy. That was what happened to that lady. She had weakness on one side of her face, and that usually happens when there is an injury to the facial nerve. The facial nerve is a nerve that supplies the muscles controlling movements on the face.
So when she came, the first thing that I did was to, let her know that it's something that can actually be corrected, and there was no need to panic. So we started our treatment modality. We started our treatment using our physical modalities. Mm-hmm. And then another important thing was we gave her exercises to also do at home. And we emphasized the importance of those exercises. And, for someone that doesn't joke with her physical appearance, she took it very, very seriously.
She's a young lady.
Yes. And she did the exercises. And our sessions were very interesting because sometimes when we're having the physio, I always try to distract her a little bit from the realities that she's actually being faced with. So sometimes I ask her, what's your hobby? She's like, I like writing. I like to read novels and stuff, And then at the end of the day, she got very, very okay and she was doing very well.
Doing very well.
Yes.
Okay. So it's such an interesting story because I've also managed several cases with this particular condition, Bell's palsy. My first PP was a child with Bell's palsy. Yeah, she was, I think, 4 years old. And the mother was concerned. She woke up one morning and saw that her daughter's face had shifted to one side. This, sometimes, some people think it's stroke.
Yes.
Yeah, it looks similar, but it's a different thing because this is a lower motor neuron lesion. For stroke, it's an upper motor neuron lesion, meaning that for stroke, it usually affects the one side part of the brain. But for this particular condition, it's a peripheral nerve injury, meaning a nerve that supplies the muscles controlling that aspect of the face. So this mother was so concerned that, is it that my daughter, she was saying that, is it that her daughter was having a stroke and all?
At this age.
At this age. So
Yeah.
she reported at the hospital where I was working. She was very concerned and we had to educate her and told her that no, it's not a stroke. and this is what happened. And prior to that, you mentioned that this lady also had ear infection.
Yes.
She was also treating something similar. I think she had an ear, nose, and throat infection or something like that as a child. So they had managed that. It was like a week after that, she just developed that sudden weakness on one side of the face. So she was bringing her daughter for the sessions, but because of the nature of the mother's job, she was not able to continue. So she needed a private physiotherapist. That is, a physiotherapist coming to...
That's what you meant by PP.
By PP, yes. Private physiotherapy practice, meaning going to the patient's house or office. It's called domiciliary services. So I was doing that for the child at that time. So I was seeing her. We started with 3 times a week. We reduced it to... But when she was coming to the hospital, she was coming daily for the first 2 weeks. Then we reduced it. When I mean daily, Monday to Friday, for the first 2 weeks. Then I reduced the sessions to 3 times a week. So as she made progress, it was now reduced to twice a week and then subsequently once a week. But she got better. She was fantastic afterwards. So we need to educate people on things like this. If the mother did not report at the hospital and the physiotherapy department early enough, it would have gotten worse. In fact, the child would have lived with that deformity for life. Imagine what her self-esteem would be like growing up with her face tilted to one side. It looks like this.
Yeah.
So and you can imagine children looking at her laughing and say, hey, see that girl that her face is shifted to one side, tilted to one side. So of course it's going to affect her self-esteem. Imagine from childhood growing up that way. But because the mother was informed, she reported at the physiotherapy department, and she got help. The same thing with the patient that he saw. She went to a general hospital. She was referred for physiotherapy, and she started having physiotherapy sessions. At this point, I would like to tell you that this podcast was sponsored by Peakline Care. Peakline Care is a physiotherapy center where we help individuals restore mobility, function, relieve pain, and gain independence. It is a place where we frame vibrant, healthy people. And if you're having pain, weakness of any sort, and you need to restore function, kindly contact us, send us an email, or call us on the numbers displayed below, or click on the link below to learn more about us. Thank you. So, Ife, I would like you to really talk about the social aspects of this kind of condition, because you would just be like, I can't go out. There was another lady, in fact, that had this same condition. She used to wear a face cap.
Yeah, some
she
people
wears
even
sunglasses.
wear hoodies.
She couldn't go anywhere.
Some people wear hoodies.
Because, how would it be that someone is talking to you and you're something like
imagine
this.
Something is even funny and you can't smile.
You can't smile because if you smile, it's like this. That's how they are. It looks funny, but it's not funny.
It's not funny.
It's not funny, actually. But some people think it's funny. And this is somebody's reality. So when they get help on time, they get better. So if you have or know anyone that has this kind of deformity, they need to see a physiotherapist. So quickly talk about the fact that, I know that lady, after a while, you guys became friends. What would have happened, socially, knowing that she's a young lady working in a business firm?
Yeah.
What exactly would have happened? How was it like for her integrating into society, her friends? What was it like for her?
So, that particular condition affected her level of confidence to start with, because, when you don't look the way you are supposed to look, there's something it does to your mind, so it reduced that level of confidence. And she's someone that likes to socialize a lot. She likes to go clubbing, hanging out with friends and all of that. So, but since that thing happened to her, she became laid back, especially when it had to do with social gatherings and social interaction, because she was not proud of herself. So, and one of the things that I did when I was managing her was to always give her that boost in confidence that don't worry, as long as you're very consistent with your exercise, you're going to get very better. And she didn't joke with her exercises. She took it very, very seriously. And she saw the results. So one thing is that it would affect your confidence level, because when you look at the mirror and you can't even smile, You know, some people try to raise their eyebrows up, but it's only one side that goes up. You know,
that goes up.
You can't even blow a balloon.
Is that bad?
You know, so the basic things that you're supposed to be able to
You're
do,
unable to
you
do.
can't whistle.
The one that you know is that really saddens me about this is the drooling of saliva.
Yeah, for
you know, when
extreme
sometimes they are talking and you just notice that saliva is seeping out of a part of their lip.
Yeah.
And you know that can be really embarrassing.
I think that's for cases that are much more
extreme,
severe, yes. But for her
or maybe
case,
when they are drinking water is seeping out of their mouth.
yes,
it can be that bad.
Then it also affects blinking.
Yeah, true.
So sometimes you see that their eyes are so teary because it's been open for a while, and then
time.
They have to like use their hand to support it just to make it close and open back. So it causes them a lot of discomfort to the eyes.
The eye.
Yes.
That's why we even advise some of them to get, you know, sunglasses to prevent
too much light.
Exactly. From
getting
hurting their eyes. So it's pretty much about starting early and knowing what to do per time, because a condition like Bell's palsy, some people often mistake it for stroke. It's not stroke. It is Bell's palsy. It's a peripheral nerve injury, and it's something that can be resolved. It is something that can be resolved with physiotherapy. We use different modalities: electrical muscle stimulation, exercises, soft tissue manipulation, resisted exercises, use of different things like balloons. There are lots of things that we do.
Then there's something,
and it's always important to do it in front of a mirror.
In front of
you were
mirror.
going to say something.
Yeah, so there's something I also would like to mention. Like, you know, before this particular lady started to experience this condition, she had an ear infection. Yeah. But it's not in all cases that it's caused by an ear infection. Sometimes the cause is idiopathic.
It's unknown.
So
it just happens.
It just means there's no cause. Like, you don't know why. I had another case like that of a boy who was in the university. So he's like 17 or 18. No ear pain, nothing. He just woke up one morning and saw that his face had shifted. So it's not in all cases that it's going to start from maybe an ear infection or something like that. Sometimes it just happens that way. So, but I had physio with him just 3 times. And that was all.
Fine. Yes, some of them resolve that fast if the injury is not so severe. So another thing I would like to say is that some people, when they travel a lot, especially road trips, if the person sits beside a window and they don't close the window, the force from the breeze can injure the facial nerve. So in such situation, especially if it is something the person does often, or it could be a truck driver. You know, most of these truck drivers, long distance trips, they are exposed to a lot of breeze. So that force can also cause it. That's in the case of trauma. Sometimes it will be as a result of an actual traumatic incident.
Yeah, like boxing.
Like boxing, or the person fell. A hard fall on that side of the head, or a punch.
Yeah,
a hard
punch can cause the face to shift instantly.
On the side of the face or the head.
Instantly.
This is the cause of the facial nerve. And when that happens, such a person can have this thing we call Bell's palsy. I would like to also say that in this kind of situation, you can't outsource, get solution to this kind of problem from medical people or traditional bone setters, or you can't tell your doctor that please give me a medication that will take it away. No, this kind of problem, it is physiotherapy that will resolve it. So that brings me to talk about the aspect of getting informed about things like this. So when people tell me that, you are a physiotherapist, I need massage, I'm like, no, excuse me, I'm not a masseur. Physiotherapists are not masseurs. We don't do massage. And massage technique is just a very tiny little bit of what we do. Sometimes I may see a patient and I don't do anything relating to massage.
It's just
So,
an aspect of our
it's
practice.
just a very tiny aspect of our practice. So if you need maybe a spa session, you can go to a spa to see a masseur. But physiotherapists are trained medical professionals. You know, that is not to undermine the job of a masseur. It's a fantastic profession as well. But you cannot say that when you need a massage, it is a physiotherapist you will go and see. These are the kind of problems that we solve. Problems that have to do with movement, not being able to move a particular part of the body. Problems that have to do with pain that is limiting movement. I can't use this part of my body. I can't move because of pain. I can't use this part of my body because of weakness. This side of because for the Bell's palsy clients and patients, one aspect of the muscles on the unaffected side, of course, was stronger than the affected side. So that stronger side is pulling on the weaker side. That is what was causing the tilting on one side of the face. So this kind of condition, it is not something that medications would address. So it is something that needs time. It is something that needs patience. It's something that needs stimulation, exercises, stretches, certain soft tissue manipulation, and then these things are done in front of a mirror, because the mirror gives what we call biofeedback. When you are seeing what you're doing, you know what to do. You know how to move it, how to move the eyebrow, how to smile. You now start learning how to smile again. You start learning how to...
Then did you mention electrical stimulation?
Yeah, I did mention it. Electrical stimulation is another key aspect of this management. Then there's something very, very important when managing Bell's palsy. Is taping.
Yeah, kinesio
taping is something that is extremely important when managing Bell's palsy patients. And taping a patient with Bell's palsy, it is a skill. It is a skill that physiotherapists are trained to do. This taping technique lifts the muscles that is being pushed to the opposite side, so that it is in proper alignment. That is what that taping does. So if the patient is being managed with electrical muscle stimulation, exercises, soft tissue manipulation techniques, taping is a key area to ensure that that position is maintained, so that recovery is achieved in that correct aligned position. So it's so important. If you're going to any physio, if probably you're having this condition, or you know someone that is having this condition, they're seeing a physiotherapist, ensure that taping is something that is included in the management. It's so important. That is why you need to visit skilled and trained professionals. So back to conversations around, the impact of physiotherapy on health. This condition, sometimes, people don't know about it, and some people don't even know what physiotherapy is. They don't know who physiotherapists are. When they now see that this is happening, they feel that they have a stroke.
Yes.
And that information that they are processing is making them think that they have a problem. And they are mentally drained. They are thinking, oh, is my life over?
Yes.
Or, okay, why is this happening to me? It's not actually that serious. But if they don't get help, or they don't get information on what to do, where to go, it can balloon into something else.
Yes.
That becomes out of control, and you'll be like, oh, this and this and this, or what even happened at the beginning. So it's important to seek help early and go to the right place.
And another thing, we're in an era now where people like to show their physical strength. Don't fight a stranger. It's a very, 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 very... it's a scary thing to do, because you don't know what that person is capable of. You understand? Some people is from a fight that they could just get a blow to the face, and then...
And that thing happens.
They start going from one hospital to the other. So if you have, if it's in your capacity to run away, you understand? The fact that you run away from a fight does not make you a weak person. It just makes you a very smart person.
It doesn't.
Because fighting a stranger can cause things that you can never imagine.
You can't
so
even
if you have
imagine.
that opportunity to run, please do.
Or leave, or
Please
just let
run.
it go. Because sometimes some people feel, okay, I want to prove a point.
Yes.
I'm stronger than him, or why will he talk to me like that? Violence.
Do you know who I am?
Do you know who I am?
I will
Violence
show you.
sometimes is not. I will show you who I am. Violence oftentimes can result into something that you didn't bargain for. You start to spend money, time, effort, running helter-skelter just to fix what the problem is. So it's important that you take note of things like this. In a place where you can walk away, please walk away. But in a situation where you could not walk away and you got injured, visit a hospital immediately. And if it is something that requires physiotherapy attention, see a physiotherapist as soon as possible. See a physiotherapist as soon as possible. And then for children, always ensure that you are monitoring your kids.
Yes.
Look at their, because I've managed 3 different children with Bell's palsy. The first one I mentioned, she was 4 years old. The other one I saw, he was 7 years old. Then another child that I saw, she was in her early teens, I think 13 or thereabouts. But they all got better. But you need to be very observant as a parent. Watch your child. Look at their body. Look at their face. What is going on? If you notice something abnormal, take that child to the hospital immediately. If it's looking like this Bell's palsy that we are educating you on, ensure you see a physiotherapist as soon as possible. At this point, we'll be bringing this podcast to a beautiful close. It's been an exciting time, and I'm sure this was
it's been
very
exciting.
insightful.
Yeah, very
and I believe
insightful.
you've learned something today. Please subscribe to our channel, share our videos, like our videos, and tell your friends about us. This is Sòrò, Sókè Physiotherapist.
Physiotherapists.
See you some other time.
Bye.
Bye for now.